All right, well, let's get started. So thanks everyone for joining tonight. I'm Kathy Nguyen, primary care sports medicine physician here in Houston, Texas. I will be your moderator for this evening. So this is the second year we've hosted a sports economics webinar curriculum, and we had a lot of great discussions last year and hope to continue them for this new academic year. Just some housekeeping rules as we get started. Please mute your microphones, turn off your videos also until we open up for questions, or this is more of a panel discussion-based talk. So feel free to put all your questions in the chat. And then we will be recording this and putting it on our AMSSM YouTube channel, so you can rewatch it as many times as you want or share it with your friends. Our next webinar, just as a plug, will be on November 8th, and the topic will be what I wish I knew versus what I know now as a physician. And the speaker for that talk will be Dr. Jean Hong, and that will be moderated by Dr. Sal Portugal. So we finished off last year with Dr. Julia Iafredi, who spoke about finding your X factor. And with today's talk, we will continue this type of discussion on, how to stand out as a sports and exercise physician in this type of field that you are already a specialist in, and how do you become a subject matter expert in this field. So we have two great speakers today, Dr. John Drezner, who is a past president of AMSSM, and then also Dr. Dusty Narducci. Instead of myself introducing them with this discussion, I'd like for them to introduce themselves and really, tell us who you are, where you work, any notable titles or AMSSM positions, and then explain to us your subspecialty. So I'll let Dr. John Drezner go first, just from seniority.
Thanks, Kathy. Nice for everyone to join us, and appreciate this opportunity to be on an economics webinar. A little different for me. But my name is John Drezner. I'm at the University of Washington in Seattle. In terms of my titles, I direct our Center for Sports Cardiology, which would be the niche for me that I'm talking about. I'm a professor in the Department of Family Medicine and editor-in-chief of the British Journal of Sports Medicine. I wear some team physician hats as well. I take care of the Seattle Seahawks, OL Reign, which is our women's professional soccer team, as well as University of Washington Husky men's basketball, and our track and field and cross country teams. Within AMSSM, I've just loved AMSSM for a long time. It's sort of my academic home. And was able to join the editorial board at some point, was a past chair of the research committee, and then went on to be an officer and AMSSM president in 2012 and 13 was the year that I did that. So I'll be talking about my, journey and passion for sports cardiology, and we'll just pass it over to Dusty for some introductions.
Thank you. It's hard to follow that, but I'm Dusty Narducci. I'm currently in Tampa, Florida, and I'm an associate professor for the University of South Florida, Morsani College of Medicine. I attended Houston Methodist for my family medicine residency and Mayo Clinic Jacksonville for my primary care sports fellowship. Team roles, I'm a University of South Florida Bull, so team physician for them, and St. Leo University, which is a smaller D2 school in the area, and a ringside physician now, and absolutely love it. MMA, boxing, bare knuckle, all that good combat stuff. And then recently this year became an unaffiliated neurotrauma consultant for the NFL. So working here in Tampa with that role, and been very involved with USA Olympic sports, most recently boxing, and always exciting. So AMSSM has just been near and dear to my heart since I was a med student. I don't think I've ever missed a meeting every year, and just get excited about it like it's Christmas. But currently I'm a sub chair for the publications committee, and it's been really an exciting role for the past 2 years. As for my subspecialty, I'm a mental health, I like to call, expert for athletes, with particular expertise in eating disorders, concussions, ADHD, and trauma stress disorders such as PTSD. So
Awesome. So two very different perspectives of different subspecialties that are very important in our field in sports and exercise medicine. So I'd like to hear, how did you guys prepare yourself to becoming this subject matter expert? Or is there a path that you prepared yourself in?
I guess I'll go first here. I think one of the messages that I would want to get across is that sometimes becoming subject matter expert and finding your niche is not necessarily pre-planned, right? I think there's a theme here that I think both Dusty and I will support, which is that you want to follow your interests, you want to follow your passion. And so for me personally, when I was in medical school and trying to figure out what I was going to do, I was at UCLA for medical school. I was on a sports medicine rotation. And there was this wonderful lecture on athlete's heart and sudden cardiac death. And it felt like everything that I had learned and was getting interested in suddenly connected, that there was this area about athletic remodeling for the heart and the potential for catastrophic events like sudden cardiac death. I went to Brown University for undergraduate. I played basketball there, and during my tenure playing basketball was also one of the years that Hank Gathers died. It was one of the most high-profile sudden cardiac deaths on the court. And I think that combination just sort of put it in motion that this was an area of interest. And during my fellowship was my first in residency, I was forced to give a presentation at the end of residency before I graduated at Tacoma Family Medicine. And I gave a presentation on sudden cardiac death. I wrote my first paper on sudden cardiac death, which was published in a very low-tier journal. And then I became a faculty member at the University of Pennsylvania, and research was strongly promoted. And at the time, this may seem like nonsense now and not something that we would research, but it was 2002, 2003, and we were actually trying to figure out if we should place AEDs at our university facilities, sports facilities. And we did a really basic survey about AEDs in Division I schools, found out that a lot of them were getting them. There were some cases of use, and the adults were surviving and the athletes weren't. And this sort of triggered, I would say, a pathway of research for me related to sudden death prevention. And it started with emergency planning and AEDs and sort of morphed into how can we improve the other side of prevention, which is cardiac screening. And that's where I would say my clinical niche has developed with ECG interpretation and the evaluation of cardiovascular related symptoms, second opinions for athletes with diagnosed cardiac conditions, et cetera. So, but all of this for me has been just following something I'm really interested in. I really can't learn enough about the topic. And it's about reading, it's about interacting with colleagues and really sort of following just a bug to learn more on the topic and see where you can apply it and make a difference.
Thanks for sharing that. I would say exactly like you just alluded to is I didn't prepare for this at all. It kind of just happened on its own. I really had to start listening to my passions and stop trying to keep up with my awe-inspiring sports and exercise medicine colleagues and just say yes to everything and really focus on what I was good at. How could I give back to the sports community, something it was missing? And everything, once I kind of had that mentality, like everything just unfolded naturally. And I was like, wow, this is what I'm supposed to be doing. I'm good at it. It's easy for me because I love it so much and it's working. I'm pretty rebellious by nature, if those of you know me on a personal level. But I really stopped listening to like protocols and, doing what has always been done with the things that I was interested in. And a huge part of this was developing my own courage to share my like personal mental health journey of everything that, I treat right now. And like, despite those moments of, imposter syndrome and people telling you that it's not going to work or don't share your personal experiences, I kind of just was like, whatever, I'm going to do what's working. And after that, everything just kind of like fell into place. I did a additional fellowship at the UNC University of Chapel Hill, and it was for leadership. And we had a project there and we could create a clinic And I was like, wow, I like really want to create an eating disorder clinic for athletes. I mean, this is something that like I would love to do. And, you know, I used that fellowship to kind of lead into that. And then everything just kind of took off after. And then there was an additional leadership fellowship I did. And then it was a business model plan kind of system. And I learned all about the finances from there. And everything just kept unfolding. And next thing you knew, I had a wait list of like 5 months. And I was like, whoa, like I'm onto something. And then I saw the connections between the concussions and the ADHD and then the trauma, stress, and PTSD and all of that, and how associated it was with athletics. You know, athletes become athletes sometimes to get away from their pain and their mental health. And if I could bridge all that, you know, so it's just been unfolding since then. It's so, you know, so much that I'm just excited to only do that for most of my career going forward. So that's kind of how it all, you know, came to play.
Yeah, Dusty, you alluded to a little bit of what my next question was going to be. It's like, are there any certificates or extra training, anything you have to do, you know, or what our members can anticipate whenever they're trying to subspecialize? Like, how do you get into knowing what you're supposed to do to get to that path? Because there are so many pathways and training modules, certifications. So any insight on that?
Yeah. John, do you mind if I go on that one? And then
Yeah, please do, Dusty.
I think I started looking into the additional certifications I needed because I wanted to be reputable. Like, honestly, that's how it started. I was like, I want people to like listen to me, but I have to have like credentials to back that up. And I actually started to get something called my SEDS. It's a certified eating disorder specialist. It's through the International Association of Eating Disorder Professionals, or IADEPT, probably about 10, 11 years ago. And you have to just take a lot of time and hours and additional courses. And it's just something I've always had a passion for. And I wanted to bring it somewhere into my career. And then when I realized that, okay, I need this because I need this to help me gain just that camaraderie behind me, you know, that people to believe in what I'm doing. And that just brought me to a whole new community, and it was fantastic. So getting that certification was, I think, very important for my specialty. I don't know any other primary care sports doctors that have that. And it's really just helped me build my subspecialty. As I've been progressing this eating disorder clinic for the past 3 years, I've seen such a connection with PTSD and trauma, and especially with athletes, those that have ADHD, post-concussion symptoms, things like that. And that led me into my additional certifications as a trauma therapist. So I got trained in EMDR therapy, accelerated resolution therapy, radically open dialectic behavioral therapy. So a lot of therapies, things that don't normally fit into our, you know, DO or MD kind of training, but it's been so crucial to what I do. And it makes me sit above the rest. And you have to have that if you're going to subspecialize.
That's really impressive, Dusty. I mean, I know you put a lot of time into that to get to where you're at right now. Um, you know, for me, when I reflect on sports cardiology and sort of the clinical skills developed over time, you know, there really wasn't a roadmap for me. There wasn't a certification or a process or even a training module for me. I think Dusty alluded to part of finding your niche may be answering questions that other people haven't, or finding the problems within our field in sports and exercise medicine, the big knowledge gaps, and thinking we can do something better. We should be doing something more than we already are. And so for me, at least with cardiovascular screening, that was really the impetus, that the evidence behind a history and physical that was now this requirement for middle school and high school and college across the nation just didn't have a backing, and other countries were doing something better. Yet we didn't do it in the US. And then you had one side of the coin completely saying, don't do it. So for me, my learning for that was not necessarily taking a course, but it was trying to gain experience by meeting with colleagues with more experience than me. Some of them were international, some of them were domestic, reading about what I could. I found some great mentors who I felt like who were cardiologists, who I felt like I could ask my really dumb questions to, you know, things that helped me understand, for instance, how to look at an ECG, and then to make it pragmatic for family docs and sports medicine physicians to look at an ECG, because I think we look at it a little bit different. And over time, that skill set just sort of grew. And now for me, I developed through research and clinical practice and a lot of reading and conferences and attending sports cardiology conferences, more of an interest and somewhat of a knowledge base on the conditions that we're actually looking for, perhaps how to either diagnose them or manage them, and surrounded myself at the University of Washington with cardiologists who are brilliant and can help. So we have very much a team approach to our Center for Sports Cardiology. That when we're seeing an athlete with potential heart disease at risk for sudden death, that we're going to have sort of a multidisciplinary look at that, both sports medicine and cardiology, and anyone else who needs to be part of that team. And that's been really helpful. But everyone on this call, when you work with someone who has a specialty and you listen to what they're doing and their guidance, there's a take home from every one of those encounters. And I think that's a great way to learn a lot more when perhaps there's not sort of a curriculum out there already. Fast forward now, and we have training modules, and we have international consensus criteria on how to look at an ECG, and a lot more information coming out in the sports cardiology space. But the field is still relatively new, and I do think that the field of sports cardiology is made up of both, sports medicine physicians as well as cardiologists.
That's great. Yeah, thanks for sharing that. So it's really interesting to see how like one subspecialty really has like a lot of certifications like yours, Dusty, and then John, yours is kind of like, how can I learn more by all these other people? And that's something we have to realize when we subspecialize, is that, it's not just one path. It's definitely different. Every story is different. So on that note, can you share like a day in the life of Dr. Drezner and Dr. Narducci? Like, what is your time like for a regular day or a week? Do you see regular general sports medicine? Are you also mostly in your subspecialty? Just for our members to know.
Sure. I'll go first, Dusty. A day in the life of John Drezner, that I'm not sure anyone wants to take that on. I spend a lot of time on my computer, reading and evaluating science, for BJSM. I would say that's my largest role right now. It feels like a full-time job without, full-time support, but it's been an incredible venture, and one where I'm learning quite a bit. I still am quite a bit clinical. I have 2 half days of clinic, and my practice is probably 50% sports cardiology and 50% general sports medicine, probably, age 10 to 80 or 90, and all the degenerative conditions, et cetera. My team care, I have 2 professional teams and my college teams that I take care of, and I feel like that keeps me grounded on what's new and what's latest, and what we should be doing as team physicians, at least. And the other part of my work day or work week would be just the research part. And research for me has been a big part of what has created this, not really subspecialty, but niche or focus on sports cardiology. And for those who have an interest on the call or listen to the webinar, when you start to get into research and you find this area that you're passionate about, and you start to address those knowledge gaps and produce new science, and it sort of drives you a little bit. Now you're getting invited to some of the conferences where you're going to learn more about that topic anyway, because you're presenting on something relevant. You're meeting other persons in that path. It all sort of steamrolls into something a little bit bigger that you can move forward with it. And it's a huge learning process, and one that can be quite rewarding. And so that niche for people on the call, like it can be almost anything within sports. Sports and exercise medicine is so broad. When you think about it, like obviously we have a lot of people who are focusing on like the super specialist MSK ultrasound. I'm going to inject everything. I can reach any nerve, like all that. And it's incredible what's happening, in that space. But there's so many other areas. We've got true exercise medicine and physical activity promotion that's somewhat neglected in our field, but people might be passionate about. You pick your topic that you might research, and maybe your niche is just a body part, that you're so good at and so focused on, or a particular clinical population that you're so interested in helping and learn so much about. You become the super specialist in that. And so I think there's lots of ways to get there, and our field's so broad, there's probably something for everyone.
John, you're like taking the words right out of my mouth here. So before I give you a little bit of a day in my life, exactly what you just said. There's so many ways to be a subspecialist, right? One of my favorite mentors, he's my boss right now, but he definitely subspecializes in heat illness, but it's through research. It's not every day in his clinic. He's not like marketing himself that way, but he does fantastic with it, or teaching, or policy, advocacy, charitable things. There's so many different ways to subspecialize. And again, like you said, we're a specialty in ourselves already. So a day in the life of me right now, I still do orthopedic clinic. I don't do any family medicine per se, but I'm pretty much all clinical. I do a lot of writing, publication, stuff like that, but that's all on my own time right now. I'm hoping that changes in the future. I want to do more of that. I think that's a way to help more people. That being said, right now, I just love my clients and my athletes, and I'm just so engaged right now in being in clinic because I'm learning so much with every single athlete that I see. I learn a little bit more how to communicate what they need, how I could be better. They help me grow as a human, as a doctor, and I'm absorbing that right now as a sponge. So I think that's where I need to be, but I do see that it's not going to last forever for my sanity because I carry some heavy stuff every day with what I treat. And having to kind of recognize that and just, stay on my path right now, but know, okay, I'm going to need more help. I'm going to have to bring people into this. I'm going to have to be able to do more research and, those kind of things. So when it comes to more of the mental health aspect, I definitely don't do as much of the therapy stuff as I want to do. We just don't get paid for that, right? I don't have the time as much as I want to. So I've learned how to really collaborate with people in my community or in whatever state that the athlete is that I'm seeing that does the type of therapy that I do for those types of conditions. I usually, bridge with a dietitian that specializes in eating disorders and has a familiarity with athletes, same as other therapists, a lot of treatment programs. So it's combining a lot of different people, which leads to having a lot of collaboration phone calls, a lot. And that is something that really can take your time and after hours, and having to just make sure these athletes are okay. There's some really serious stuff. So right now, I wouldn't say it's the best work-life balance. I don't know as a physician if you'll ever have that. I like to call it work-life harmony. It's always going to intertwine. You just have to learn how to roll with it and make it okay and make sure you take care of yourself. So I created that eating disorder clinic like 3 years ago. And right now it's just so much of an influx, and that's kind of actually scary to see of how many people aren't taking care of such a critical thing. And kind of like I can't take on too much and then fail them, right? But I have to be there enough that I don't lose the subspecialty. It's like really finding a balance. So I'm in a very new stage of this and giving that perspective of every day I'm learning, like, how can I be better? How can I change things? I look at the big picture and then kind of just reorganize it and see what do people need? What do I have to get trained in better? Where can I ask for help? So it's a lot of planning and a lot of just taking care of patients right now for me. The sideline stuff, I enjoy it. I've learned how to say no to the stuff that I don't, because that is kind of some of my social life right now. I'm just being very honest. If I don't like it, I don't want to be there. I don't have a lot of time. So it's kind of where I'm at right now in this whole subspecialty switch.
Yeah, thanks for putting that perspective in there, because a lot of times, as a new fellow graduating, you think sports and exercise medicine is either straight orthopedic clinic or straight mixed family medicine, sports medicine, and then you're out there in the sidelines and you have to put your face out there for game coverage. But our field is so broad, and it's really nice to see the perspective of two people who are doing very important things in each subspecialty, and it's not just what we know as we became fellows in sports medicine. So I really love that. And as this is an economics webinar, we have to ask a little bit of the finances in there. So, is there any special funding that you guys have in your subspecialty, or do you have any tips and tricks for funding when you're trying to, establish yourself in this niche? And, you know, do you have an opportunity cost for subspecializing in your field?
Don, you want to go first or you want me to go?
Sure, I'll comment on this a little bit. Like I said in the beginning, being on an economics webinar for me is interesting. I've been university-based, academic-based, pretty much salary only forever, and so I know that in other settings, the economics of clinical practice are way more important than what happens sometimes at the academic centers. And you could certainly use the economics of something to motivate you to find, quote, your niche. But I'd probably argue that what you're doing is you're motivating yourself to find something that is financially beneficial, and it may not truly be your niche. It may not truly be your passion of what you're doing. Maybe they align, maybe they don't. At least for sports cardiology, this is not in any way, shape, or form driven by economics. In fact, it's probably the opposite, meaning that we go out in the community and we do heart screens for free through a foundation. We created an ECG heart screen in our clinic that's very low cost, and making sure that we have funding available to screen kids from lower socioeconomic families, and basically who are on free and reduced lunch at school and things like that. But what has been economically, I would say, healthy was the creation of a Center for Sports Cardiology, which brought in funding from the medical center academically to help support it, and also created an umbrella for all of our programs, whether they're clinical research or outreach. And with that comes the opportunity to do some philanthropic fundraising. And when you can raise some of those dollars, now you have some flexibility, hopefully, to apply it in places that you want. So that's not your pocketbook and your bottom line, but it really feeds your passion. It feeds what you can do in the community, the impact you can make, maybe the research project that you can do, things like that. And so I would say that the economic side for sports cardiology, at least from the sports medicine, vantage point, is no different than any of the other patients we're going to see, except you're going to bill for an ECG. But there's other reasons that people might be interested in it. Dusty?
No, that's helpful. Thank you. Also in an academic position right now, I think it's been a little bit of a wake-up call of they're not all the same. I've been in a few different academic institutions so far in my career, and sometimes you're seeing 6 patients, sometimes you're seeing 25 patients. It's RVU based, it's not RVU based. You have a lot of time for research and scholarly activity and planning, and then sometimes you don't. And I think that's a huge message today of just because you're going on one path, it doesn't mean you have to stay there. Like, life's all about changes and, shaking things up sometimes and seeing what's a better fit for you. If you think you're private practice, but then you want to go to academic or vice versa, because sometimes these aren't the most lucrative when you're in academics. My clients, definitely my athletes, don't make any more money. I would say it's more work for the lack of RVUs and time and things like that. It's very complicated. And I remember when I first asked to create this clinic, I actually walked into one of our boss's offices and I said, I just want a half a day because nobody believes me that this is going to work. Just give me a half a day of my clinic and you can take it out of my salary if you need to. And I knew what I was doing. I'm pretty good at negotiating. I don't love ultrasound, but I'm really good at it. And I make a lot of money for that. And it takes my time, but not that much time for how much I can, keep my RVUs up. So I was like, just give me this half day. You can take it out of my salary if you want. I rented a little clinic up in our building. And I said, just give it a chance. And it didn't take long. I knew what I was doing. I knew it was going to work. And I was so passionate about it. So would I say that's what keeps me there because I make them a bunch of money? No, not at all. It's my passion and I'm happy and they support that. Will that last forever? I don't know, right? I mean, there's more that I want to be able to do and things like that. Recently, I was able to create a nonprofit. That's been a dream of mine since college, and it was just not the right time. I mean, that takes a lot of time, and the IRS officially approved it as a 501c3, which is awesome. And I feel like I'm able to write any document right now after creating something like that. But I would love to tell you that the only reason I did it was because I want to give back to my community, and I'm such an amazing human, which part of that maybe, but like the big part of that too is the financial gain from it. I can get grants easier. It brings me an influx of, patients, athletes that I'm able to help because I created the nonprofit around my subspecialty. It's for athletes with mental health of the types that I treat using the therapy I do. So right there, it gives me time. It gives me a little more freedom to see who I want and to give back to the community at the same time. And if anybody's on crazy loans from, Caribbean schools or things like that, you can be your own boss through a nonprofit, just an FYI. There's some really neat things you can do financially. And I mean, we could probably talk about it in the whole lecture. So a whole hour of just financial stuff. But yeah, it's been an interesting road.
Yeah, that's great to hear. And, I'm coming from an academic center myself too, which is very different models than you guys. And I also did private practice for some time. So, it's interesting, like you said, being in academics, it's not always known as a lucrative field, but you can subspecialize and do specific things in your own academic center. And if your academic center allows you to, then you can really branch off and be able to build your own wealth in a different way. And really, this talk is presenting economics in a different light. Wealth is not just how much money is in the bank, right? It's like being happy in your role and feeling fulfilled with the economics that you currently have because you absolutely enjoy and love your job. So making more money doesn't always mean, you're absolutely enjoying your job. So thank you for your perspectives on that.
Hey,
So
Kathy, I just want to piggyback on that because I think what you just said is so important, that finding your niche, finding your passion and be able to live that day to day or part of your week or whatever, there's so much value in that potentially is not economical, right? I mean, longevity in the field, physician satisfaction in your job, things like that. It's so important. So when you are following that, what you're most interested in, that passion, whether that is something clinical or a research area, or policy driven or creating a 501(c), which is amazing, Dusty, things like that. There's so much value in that, and it's not necessarily economical. That's a really important point.
Such an
Right.
important, when you get to live out your passion, it doesn't really feel like work. I mean, it is, and it's your time, but it's so fulfilling. It's very different. I feel like it's finally not just a job.
Yeah, that's great. And realizing that once you are at the level where you guys are coming or have become, you really get acknowledgement from your peers and then your patients, that fulfillment in like doing the right thing and inspiring, leading, teaching, and helping our patients is really rewarding. And so, this is really like a pitch to our members to say like, hey, you don't have to just be a proceduralist unless that's what you love to do, so really different ways to have fulfillment and happiness in our roles and our jobs. So kind of as you've gone through this journey, have you guys learned anything new or anything that surprised you when you decided to subspecialize?
Dusty, you want to go first?
And I have so much to say about that, right? I'm like, first, don't let your dreams kill you. I mean, if anyone knew me 3 years ago, I was supposed to be married with kids and trying to just be comfortable as a Division I college physician. And that is so not who I am anymore. And that's okay. Like my life totally switched around and I've never been happier and healthier. And I actually get to do what I want to do and give back. And things just make more sense now. But I think we get very stuck on, well, I was told myself that this was my goal and I have to get there. But then we're kind of like miserable along the way. And then we get there and we're like, this is not what it was supposed to be. And that's not good for anybody. It's not good for you. It's not good for your family. It's not good for your athletes, your patients. So when I finally kind of woke up and saw that, it was such a beautiful lesson. I'm always going to have failures and setbacks, like hiccups, but I've really learned to look at them as an opportunity to just grow as a person and just be resilient and just like kind of with humbleness and kindness and just like rise above. It makes you better. So like, I never even want to think of it anymore as like hiccups or anything. It's just, oh, well, that's today. And what can I do better tomorrow? I can go on forever, but I'll let you go a little bit, John, and then we can go back and forth if you want.
Yeah. So Kathy, the question is, what did we learn along the way? Is that
Yeah, or what have you learned along the way, or what surprised you through your journey as you've gone, into your subspecialty?
sure? Um, there's, I think one of the things I've learned along the way is you really got to listen. Um, you have to listen to the people with different perspectives. You have to listen to the people who maybe have more experience, and you have to really take that in and understand what to do with it. Another thing that I think has driven me at least, and I think is part of finding your passion or at least carrying out your passion is don't be afraid to question the status quo. That medicine has evolved to be better over time because people are questioning what we're doing and asking if we can do it better. And there should be good hypothesis-driven research and studies or policy that evolves because people sort of challenge what everyone is doing already. Should we just be injecting the subacromial space, or should we be using ultrasound to do it, right? And should we just be using a history and physical, or should we add an ECG to it to accomplish the same goal better? And how do we do it and do that well? And so I would say that, as you explore what you're thinking about and you come across these questions, like carry forward with it. And often that starts with early mornings and later nights and sort of, creating projects or learning about becoming a topic expert, etc., for the more junior members on the call. But it's well worth it in the end if what you're doing sort of drives your day, and that, when you're doing something that you love to do, sort of every day becomes a good day.
Yeah, absolutely. For a long time, I had a lot of disagreement with some of the ideas like protocols, beliefs, treatments with mental health with athletes that we currently do, or terms, definitions. And I was very focused on kind of abolishing that rather than just what am I good at and what can I do to help? And if things work out and I'm onto something, it'll go from there. So once I kind of understood that that's not what this is about, it's about helping and putting your ego aside, and just doing what you think's right for the better purpose of our patients, right? And our just community. And once I did that, I really was able to listen to other people and take their advice and take their thoughts and then create my own opinions, with confidence, right? I knew that I looked at everything with an open mind, and then I was able to come in and say, wow, I think this is gonna work, and then be willing to change it if it doesn't work, and be willing to kind of just receive additional learning and education and all that good stuff.
And when we were pre-planning for this discussion, you really talked about being authentic to yourself and being authentic to your vision, paving your own path. And I really do think that you guys have both have stayed authentic to your interests, and it really has shown in your expertise and knowledge. And along the way, any pearls, any very general pearls you can give to us as members to just really ignite that spark if any of us are interested in subspecializing.
I really tried to define my subspecialty, as I was creating it, after, in the beginning, it kind of just unfolded naturally. But then when I started to see, okay, I'm onto something here that's working, let me use clear communication so I can get that across to my colleagues and get that across to my patients, right? So who's my target, or what's my target if I'm going to subspecialize? Why am I uniquely qualified to do this? And if I'm not, what do I need to get there? Is there a need for this expertise in subspecialty? Am I going to be helping? And then also, where's your practice setting? Can you do this academic? Do you have to do this private practice? Can you do it on a field? And then how are you going to profit from it? You have to make a living, whether it's with a salary or it's on your own or whatever it is. But really laying the answers to those questions out was so helpful for me. It's almost like a little elevator pitch, and then you could just run with it.
Yeah, I'd say my pearl would be, follow your interest, follow your passion, and don't expect everything to happen overnight. You know, one step should lead to the next step, and this is all about baby steps and getting on first base and not necessarily hitting the home run all at once when it comes to learning what you want to learn, or perhaps doing a project or research or starting a new clinic or whatever. That it has to start somewhere. And if you have a general interest, that first step should lead to the next step. They're all connected. So now you're learning something more or different, or meeting with a different person. You know, in 2002, I mentioned that we were debating whether or not to put AEDs at University of Pennsylvania athletic facilities. And today I spent an hour and a half of my afternoon doing a site visit to a local park, multi-field complex in an underserved neighborhood where we're going to put an outdoor AED and understand where to put it. And everything's connected, right? So the things you do over time to develop your passion and grow your understanding, or maybe develop a clinical niche, can still have a big impact, out in the community. And I would just say, one step at a time, and they should all be connected.
That's great. Oh, as you know, we all go into subspecializing and such too. I think it's really key to maintain your network and know your mentors and know the people to discuss with, like as you guys were talking about, mentioning like who is in your corner and then who can you reach out to learn from. And it's really something that as a physician, sometimes you're so boggled down on your work that you don't think about reaching out, but we have to kind of keep our network broad and try to maintain the relationships that are important, so that you can really be an expert or fulfill yourself in your roles.
And I'd say, Kathy, just, this is AMSSM, right? And so mentorship should be wealthy, right? There should be a wealth of mentorship within AMSSM in so many different areas of our specialty. So whether or not that's someone in pediatrics or emergency medicine or physiatry or family medicine or internal medicine, or a specific clinical or research niche, or et cetera, there's probably other people in AMSSM, maybe with the exception of where Dusty has brought herself with her training, that can help, and that you can connect with, and everything is always more fun when it's done collaboratively and there's other people who are helping with you.
Absolutely. But I've built such beautiful relationships with people outside of the sports and exercise medicine community, from athletic trainers to therapists to dietitians. But it's been so wonderful to tell them about AMSSM and the sports medicine exercise community. They don't even know that exists. It's been such a really unexpected bridge. I've learned so much from them that I can bring back, and then that helps our colleagues, and it's such a pay it forward kind of thing, and back and forth. And I just love the relationships. I really do.
Awesome. Well, thanks you guys for sharing everything that you did tonight. I'd like to open up the panel for any questions, or if you want to turn on your videos and have a chat with us, pick the brains of Dusty and John. Feel free to start that now. There was a lot of questions already as we talked through this, so we'll just see if anybody puts anything in the chat, or if you guys have any last minute thoughts.
Hi, I'm Trada Ashford. I'm a second year medical student at the University of South Alabama. And I'm part of AMSSM, and I just wanted to know, I'm interested in primary care sports medicine and implementing health equity into it. And I just wanted to know if y'all had any tips or any contacts to get started with it. And then I just messaged Dr. Drezner. We have a local sudden cardiac arrest group, a fellow medical student of mine. His mom created a nonprofit called Heart for Athletes, because her son had a cardiac arrest, and I've been helping with that. And my kind of role with it, as we're trying to get into low income schools and do the screenings. And then we're already partnered with Duke. We just submit our EKG screenings over to Duke. So I just needed some help. And she also does like AEDs, AED protocols and stuff within the state of Alabama. So we've just been trying to get more done, essentially.
Yeah, Jada, thanks for your comments, and I see the message in the chat as well. And congrats on doing all this in your own community. I think health equity and sports equity is a massive topic that we're all, I think, trying to take on, both as an organization with AMSSM, within research. You know, equity, diversity, inclusion for BGSM is front and center, and priorities, and really everything we do in the fabric of our journal. And I think related to the topics that you just brought up, you know, health equity makes a big difference. Like, you can't go in and screen kids with an ECG if you don't have the resources to do the secondary investigations of the tests that they might need if they have an abnormal ECG. That becomes problematic. And so, at least in Seattle, before we started our heart screening program with the Nick of Time Foundation, a local nonprofit, we made sure we had the charity line of care, that any kid that needed more investigation could get the same workup that we would normally do at Seattle Children's Hospital through this charity line of care. When we raise money for AEDs in the community, we're prioritizing certain neighborhoods with more socioeconomic deprivation, for instance. So I think health equity will certainly come into play in almost all of our potential, you know, subspecialty focus areas of sports and exercise medicine. And it's a really big one. If you're interested in exercise medicine and physical activity, oh my goodness, the health disparities are incredible. And health equity plays a massive part in that, unfortunately.
Thank you.
I would add on to that, if you want to start somewhere, you know, as a med student going into residency, depending on the location where you're at, it's always good to look into the, you know, public health schools close by, nearby, see if they have any ties, or if you really want to make an impact, you can go small, start in your community, talk to the local nonprofits or the school systems close by and see where you can start making an impact, and then grow from there. It doesn't always have to be a massive project. It can start small in one community, one school, you know, one community center. So it's amazing that you already thought about that now. Okay, any other questions or comments? All right, well, if there are no further questions or comments, I'd like to thank Drs. Narducci and Dr. Drezner for joining today. Such a great discussion, and really thank you for sharing your path and your journey to getting where you're at, and really being vulnerable and letting us know, you know, why you got where you are and how your journey is continuing to grow. And we really appreciate your insight today. And just a quick plug again for November 8th for our next webinar in sports economics. And if you guys are interested in listening more on our about our curriculum, go ahead and go back to the AMSSM YouTube channel. There's tons of videos there. All right, thanks everyone.
Thanks so much, Kathy. Thanks for
Kathy.
joining, everybody.
Thank you.